Cancer, it's a word that brings fear, but also a lot of confusion. Many patients and family ask me, why is it taking so long to get a clear answer? Why do different doctors sometimes say different things? Today, let's unpack why cancer diagnosis can be complex and how we can make sense of it together. Cancer is now one of the most common health problems worldwide. In fact, about 1 in 3 people over the age of 70 will be diagnosed with cancer in Australia. And many millions of people today are living with cancer. Thanks to medical progress, we know more than ever before about how cancer works. But this also means diagnosis has become more detailed and more complex. Think of cancer like a giant tree. It keeps growing new branches with more subtype and more layers of diagnosis. Cancer is not just one disease. It is actually a family of over more than 100 different types. And when you add genetic subtype, there are thousands of distinct cancers. So how do doctors figure it out? We look at cancer on 3 different levels. Firstly, where it starts, which organ or a tissue, lung, breast or colon. What type of cells are involved? This is called the histology, as each organ has a multiple type of cells. What gene changes or mutations are driving it? This is called the molecular profiling. And some cancers are rare and complex and they don't follow this rule. So they don't fit in this category. Even one organ like the lung or colon can have many subtypes. Each behave differently. That's why peeling back each layer of diagnosis takes time and requires the right expertise. Therefore, diagnosing cancer is never a one-person job. Even though you may first see a surgeon or oncologist, there is a whole team working behind the scenes. So, who is involved? A radiologist or nuclear physician review your scan. An intervention radiologist or a surgeon or gastroenterologist arrange your biopsy or a surgery. A pathologist examine your biopsy under the microscope, and molecular scientist would uncode your cancer's genetic profiling. Access to this expertise can vary from one hospital to another, which can sometimes lead to the delay or a difference in opinion. It is like building a giant puzzle and each piece takes time to fit in. No test is perfect. Scan can miss very small tumors. A biopsy looks at just one tiny part of the big cancer, and different part of the tumor can behave differently due to their genetic variability. Some uncertainty is normal. The body is complex, tests have limitation, and doctors must carefully interpret the results. Therefore, it's okay if more tests or opinions are needed. It helps us get the best answer for you. So what can you do as a patient? Firstly, it's important to see the right specialist at the right hospital to guide your journey towards the diagnosis. Until we know exactly what type of cancer you have and what stage it is, we cannot plan the best management plan for you. Therefore, need to be patient until get to this stage before asking the big questions. Every cancer case is unique, just like every human being is unique. We all share 99% of the same genetic material, yet no two people are exactly the same. We have a different life experience, environment, exposure, and biology, and so do our cancers. That's why even if 2 cancers sound similar, they can behave very differently from one person to another. Therefore, please don't compare your cancer to someone else. Your journey, your body, and your treatment will be uniquely yours, and we can tailor it just for you. In some cases, going to a high volume cancer centers or collaborating with them can help, especially for a rare or uncommon cancers. Ask your doctors, do we have a multidisciplinary meeting or a tumor board to review my case? These meetings bring together experts to look at all the pieces of your cancer puzzle and give the best advice. Remember, cancer diagnosis is a process, not just a label. It's okay to ask questions. It's okay to feel confused. And most importantly, it's okay to take time needed to get it right. So keep patience. Thank you for watching. Stay strong on your journey with clarity, confidence, and courage. Thank you.